today is Cancer Awareness Day. Let me talk to you about two important gynecological cancers. One is cancer of the breast and the other one is cancer cervix. So today, just be aware of what your risk factors can be. So if I take a very wide margin, I can say that the risk factors for most cancers either could be genetics or there could be lifestyle, an unhealthy lifestyle. There are some forms of cancer which are related to obesity, with high blood pressure, with diabetes. Other than that, a lack of exercise, smoking, alcohol, occupational hazards, and exposure to chemicals. These are some of the factors which could lead to some kinds of cancers. So, if we talk about cervical cancer, remember that cervical cancer is caused because of unsafe sexual practices, having a partner with multiple partners or having multiple partners, sexually transmitted diseases like the HPV infections. Also remember that smoking itself is a factor for cervical cancer, having babies very early on in life, having multiple pregnancies and deliveries and starting with the process of childbirth at a very young age, unhygienic conditions, sometimes racial factors also play an important role. So these are some of the reasons why cancers can be more rampant. Also remember that most of the hospitals have screening programs. Now, what do we mean by screening programs? Screening does not mean that you have the disease, but it means that we have a program wherein the general population at a particular age and beyond a particular phase in life will have to undergo some tests which are simple tests in the hospital. So there is a protocol for every kind of cancer screening. For instance, with cervical cancer, we begin at 21 years of age and we continue till about 65 years of age. We have pap smears which need to be done once every 3 years. A human papilloma virus detection which can be combined with a pap smear, and this needs to be done once every 5 years up to an age of 65 years. With breast cancer, we have certain screening programs like an ultrasound of the breasts which can be done beyond 30 years of age, and beyond 40 years of age, we have a mammography which needs to be done. Some societies believe that it needs to be done after 45 years of age and it has to be continued till 55 years of age annually, and thereafter you can make it once every 2 years till 75 years of age. So we have these screening programs which are available in all hospitals. The idea of screening programs is to pick up these cancers at a very early stage so that they can be treated very easily. Also remember that you need to have a healthy lifestyle if you need to prevent these cancers. There are human papilloma virus vaccines also that are available, and girls between the age of 9 to 26 years of age must get this vaccine. It is largely protective against cervical cancer. Stop smoking. Stop using alcohol or limit the alcohol that you are using. Lead a healthy lifestyle. Make sure that you are exercising. Make sure that you are eating healthy. Make sure that you do not have too much of processed food which contains a large number of chemicals. Also remember that you should have healthy and safe sexual practices. And also make sure that some family planning method is used so that you do not have repeated pregnancies. So generally, all these factors will be able to prevent the chances of getting cancer. And it's important, most of all, like I said, for most screening cancers, eat healthy, exercise well, lead a healthy lifestyle, quit smoking, Limit alcohol use in case you do need to take alcohol. If you can completely get rid of it, that's fantastic. Know your risk factors. Get your screening tests done. If there is a problem, early detection of the same will go a large way in saving a large number of lives. So, stay aware, stay focused on your own health. Women need to focus on their own health because for most of us, we are the last priority. We must make ourselves the first priority so that we can take care of our entire family.